my channel. My name is Nosketa and I'm a break addict. It's been a while. Yes, sorry, I'm coming this period. The last video was around 2 weeks ago. So sorry about that. Your nose has been busy. Okay, so what I'm going to discuss today, I'm going to discuss something so important. I'm using this medium to greet all our art clients who are challenged due to one thing or the other about their hearts. So today we are going to speak on how to care for heart failure clients at home. You have been diagnosed of heart failure and you have been managed in the hospital, and your doctor tell you, Mr. A, you're going to be discharged home. You are going to be discharged home. So how do you continue with the care at home? How do you continue to manage yourself? That is why your nurse is here, your favorite heart nurse, Kate, is here to teach you on how to manage yourself at home. So welcome back once again to Heart Health. And this is Nurse Kate TV, where we teach you how to make your heart health a priority, and also talk about nursing care. So if you have been discharged home, on how after being diagnosed of heart failure, what else? How do you continue to live well? How do you continue to maintain your health at home? So number one point is, when you are going home, don't forget to have your own blood pressure machine, your own weighing scale, because those two are very, very important. You have to start checking your own weight every day, and you have to start measuring what your blood pressure by yourself, okay? And also don't forget, ask your doctor or your nurse to teach you how to check your pulse rate, because it's very, very important when taking some of your medication. So when you get home, make sure you already know how to check your blood pressure, because you're going to be doing daily monitoring of your blood pressure and daily weighing of your weight. And you have to have your diary where you are writing your blood pressure and also you are writing your weight. So when you have those and you have done that, don't forget the next thing is your diet. I'm sure the dietitian will have spoken to you before leaving the hospital, or your doctor or your nurse, that you have to stay away from food that are very rich in sodium. You have to stay away from salt, and you have to have a low water, because a lot of water is in your body, so you have to reduce that. And also you need more of potassium. If you're in a particular drug that has potassium, that makes you to lose more potassium, okay? If you're on hydrochlorothiazide tablet that makes you to wee frequently, you might be on potassium, or you're encouraged to eat food and forget the foods that are rich in potassium. So don't forget that you have to be on what low food. You are not going to be taking a lot of water like you used to take before the heart failure. Then activities, you have to minimize your activities. You won't be doing strenuous exercise that can reduce your energy, that can consume more of your oxygen. So you have to be just a trek, walking. Okay, so you might need to create time for you to rest. Okay, you have to always create time for you to rest. And as well, we're going to talk about drugs. As heart failure clients, you might be on furosemide, hydrochlorothiazide, digoxin, and those things can make you to, especially furosemide, that can make you to lose more water, that can make you to lose potassium, like I said before. So you might be on the potassium supplement. Please take your drugs. But one thing that is very, very important and you have to be conscious about is your digoxin, and maybe your metoprolol or beta blockers like Panadol. Then you have to learn how to check your pulse rate for 1 good minute, because you have to check this pulse rate and count. You cannot take all those digoxin if it's less than 60. You cannot take that if it's less than 60. So you have to calculate it and see if it's above 60, then you are safe to take your digoxin. If it's less than 60, please contact your physician or your nurse immediately. Then if you want to stand up, don't just stand up like this, Okay, so always stand up gently so that you won't have hypertension, or you won't feel dizzy, you won't feel um, as if you want to collapse. So please, for your safety, when you take your antihypertensive, please relax, relax gently. Take your time to stand up, take your time to stand from your bed before you stand up eventually. Okay, I hope this video will help our client who has heart failure to stay safe at home, to stay healthy, and also to live well with what? With heart failure. Thank you for always watching my channel. If you are new here, please don't forget to subscribe. Click the button, subscribe, and I will see you in the next video. Noske TV, please subscribe. Bye.